welcome back to my channel. If you're seeing me for the first time, my name is Sharon and I make YouTube videos as a hobby. So I've been getting quite a bit of interaction from you guys, which I love. I love it when you guys interact with me because it lets me know that I'm not talking to myself in my room. However, I've noticed that some of the questions you guys have been asking me started to kind of repeat themselves, started to get repetitive. So I decided, instead of answering each question in like extreme detail for everyone that messages me, I'm just going to make a video for that, and in the future when you guys ask me these questions, I'll just redirect you to this video. So let us begin. So Zambia is a country in southern Africa. We're in SADC. So for me, particularly, South Africa is not an option for me. So I had the choice of going to China or Russia or anything, and my family and I felt that it was best for me to be in Zambia, despite me not being Zambian. So these questions I got were basically from two types of people: from international students and from local students, people from Zambia who want to know more about medicine. So I'm gonna put these questions into two categories. I'm gonna talk broadly first, then I'm gonna answer the questions for the international students and then for the Zambian students, right? Okay, so Zambia has kind of had a new resurgence in terms of its medical schools, right? Zambia has so many medical schools. The only country that rivals Zambia in terms of the amount of medical schools it has, I would say, is South Africa, in SADC, and maybe Central Africa. I'm not sure about those countries, but I know in SADC there's no country that's touching South Africa and Zambia in terms of how many medical schools they have. They have so many medical schools, and it's a lot of options for people. And yeah, in South Africa it's out of reach for a lot of people right now, so Zambia becomes the new go-to, right? It's now Zambia is in the league for medical schools. Zambia is where it's at. So basically, Zambia has private institutions and public institutions for medical school. The public institutions would be, Unza, Apex, Mulungushi, and Levy, right? And then the private institutions would be Texila, I think Cavendish, and Unilas, which is my school. I got Unilas, and it is also a private. So yeah, I applied and they took forever to get back to me, and it was a long situation. I actually ended up having to come to Zambia myself, and I know that's not feasible for a lot of you, but it's just one of those things that you're gonna have to deal with, because the application processes can get really, really tedious. They can get very annoying, but for the most part, yeah, it ended up working out for me. So Zambian universities are typically between 6 to 7 years, depending on the pre-med situation. For public institutions, I know that pre-med is 2 years, and then 5 years after that is medical school, and then for my school, it's 1 year, 6 months, and then 5 years of medical school. My school personally has a year of pre-med, 6 months of bridging, and then 5 years of medical school. Within those 5 years, we have 2 years of medical science knowledge and then 3 years of clinical rotations, and every other school kind of follows that same system. The only difference for my school being that we have a systemic way of learning medicine, and some schools, most schools in Zambia, if not all, they do regional based learning. So they learn according to the region of the body, and we learn in terms of the systems, and that affects how many courses we do each year. So I am in direct entry, so I'm doing 10 courses right now, which is divided into 7 courses, like mashed together, but it's just 10 courses. And if you're doing a regional based learning, you might be doing less courses. I cannot speak for other schools, I can only speak for mine. So when I'm speaking about the other schools, it's like in general. So like I said, I got into direct entry, which means I didn't have to do pre-med or bridging. Why? Because I'd already done my pre-med at the University of Botswana. But if you haven't done your pre-med, you would have to start from pre-med. If you've done pre-med or A levels, or I believe if you have some kind of health related degree, you might get exempted and you can go directly into direct medicine instead of having to do your pre-med or your bridging. But that depends on, what your results were, what type of grades you got. Okay, so another thing that I would say would be that go to school. Call the school, talk to them, ask them. And I know it's so difficult to get in touch with these people. It's so hard. It was so frustrating for me. But you know, eventually when you call them or contact them or something like that, they will get back to you. And because Zambia has so many universities, you have a lot of options. You have so many options. Yeah, I hope I haven't forgotten anything. So I'm going to talk about the Zambian students now. Someone asked me, like, they're in grade 12, they just finished their grade 12, and now they don't know like what is the path you take, like they don't know what happens afterwards. After grade 12 you do pre-med. So if you go, let's say you go to UNZA or Apex or something, you do pre-med for 2 years. If you go to a private institution like my school where it's 1 year pre-med, you do your 1 year of pre-med. In pre-med you learn basic sciences, you learn advanced chemistry, biology, maths and physics. And then if you pass your courses, for private institutions like my school, if you pass your courses, you go to bridging, and then in bridging you do, I believe it's medical ethics, medical terminology, biochemistry, and the history of medicine. So those are the 4 courses you'll be doing. If you pass that, then you go to direct entry. And I know that for UNZA and other public universities, it's extremely competitive, and they don't take you based off of you getting above 50%. They take you based off of you, I don't know, being in a certain range, whether it be 70 people or 80 people, I don't know, but it's way more competitive in a public institution. So that's what happens. And then when you're in direct entry, once again speaking for my school, you do 10 courses which have been mashed into 7: public health, behavior science, anatomy, a lot. It's on the school website. You do those courses, and if you pass those courses for 2 years, you do them for 2 years, the pass mark is 50%. You're marked according to CA. So if your CA is out of 40, and then the exam is 60. So if you pass, you make it to clinicals. And then after clinicals, you graduate and you do internships. And then after internships, you are free to specialize if you want or not. So yeah, that's the video. Yeah, if you have any more questions, you want to interact with me, you want to say anything to me, let me know in the comments or in my emails, my DMs. Talk to me, interact with me, so I know I'm not talking to myself, and I know that I'm not a crazy person. But until next time, bye.